Hello everyone, welcome to my channel. So from this video we are going to start neurology, and the first topic in this video I'm going to discuss is cranial nerve neurotomy and a little bit about their functions. Okay, so first of all there are 12 pairs of cranial nerve each side on the right and the left side. Okay, first cranial nerve, first we'll discuss first two cranial nerve, that is olfactory nerve. It is very short. It has a short pathway. It starts from the nose. It goes through the cribriform plate and it goes to the frontal lobe, and it is responsible for the special sensation like smell. Okay. Second is optic nerve. Optic nerve is a very important nerve, especially for neurology. Okay. It is actually right now they have proven that now they think that it is not a true nerve. Basically it is considered as a part of the brain because it has its own meninges. Okay, so optic nerve, it is responsible for vision. Okay, I'll shortly describe the anatomy of the optic nerve. So for example, this is the eye. Okay, it starts from the retina. Okay, this is right side, this is left side. Okay, and this is your temporal field of vision, this is your nasal for both the eyes, and this is again your temporal field of vision. Okay, now there are temporal fibers for each eye, and there are nasal fibers for each eye. So in eye, the for example, if this is the temporal fiber of the right eye, okay, so the visual field that is carried by this temporal fiber is the visual field, so it is opposite. Okay, and same thing, nasal fiber will be carrying the vision from the visual field, that is temporal part of the visual field, so it is opposite. Okay, okay, so this is carrying the, so temporal visual field is reflected on the nasal fiber, and nasal visual field is reflected on the temporal fiber. So it is an opposite carrying of the visual field. Okay. Now at the level of stellar region, okay, where there is pituitary gland, above pituitary gland there is an optic chiasma where the nasal fibers from both the side will cross. Okay, will decussate. Okay, so this is the nasal fiber, and now the opposite side, so on the opposite side of the nasal, so this is called optic nerve, this is called as chiasma, which is present above the stellar region. Okay, then on there will be optic tract. So basically right optic tract is formed by the right temporal fibers and left nasal fiber. Okay, so basically right optic tract is carrying the vision from the visual field of right nasal field and left temporal field. Okay, so it is opposite. Okay, so this is optic tract. Optic tract will go into the lateral geniculate body. From lateral geniculate body, so it will go into the temporal lobe and the parietal lobe, and it will form the optic radiations. Okay, so optic radiation, and it will go to the optic radiation, it will go to the occipital lobe. Okay, so it will go to the occipital lobe, both the sides. So now here you have to understand that there are two types of optic radiations. Okay, optic radiation in the parietal lobe, that is present superiorly, and in the temporal lobe, that is present inferiorly. Okay, now again the visual field that it carries will be opposite. So parietal lobe, which has the superior optic radiation, okay, or upper optic radiation, will be carrying the visual field of the lower visual field. Okay, the and temporal lobe is inferiorly present, so it will be the carrying the optic radiation in the temporal lobe will be carrying the vision from the visual field, superior visual field, so it is opposite, just like this is opposite. Okay, nasal and temporal, parietal lobe and temporal lobe will be carrying opposite visual fields. Okay, optic now is a little bit we need to understand in detail. I'll take in another video more about the lesions of the whole optic nerve pathway. Okay, this is just a short form. Now from third, now the origin of the cranial nerve starts from the brain stem. Okay, so first of all I will explain in brief about the origin of this cranial nerves, and it very simple form I'll explain. This is your midbrain, this is your pons, This is the schematic diagram, and this is your medulla. So this is your midbrain, this is pons, and this is medulla. Okay, and after medulla there will be spinal cord. Okay, if you divide this into medial and the lateral parts, okay, all three are divided into medial part and the lateral part. So this is your medial, this is your lateral part. Okay, midbrain will divide into two parts, superior colliculus level and this is inferior colliculus level. Okay, now just remember there are four midline cranial nerve nuclei. Okay, so 3, 4, 6 and 12. Okay, 3 and 4 are present in the midbrain in the midline, 6 is present in the pons in the midline, and 12 cranial nerve nuclei is originating in the midline in medulla. Okay, so these four nerves are important. Apart from this now, in midbrain there are no other nerves. In pons there is 5, 7 and 8. 8 is divided into like the number 8, it is divided into two parts. One is cochlear nucleus and second is vestibular nucleus. Okay, and as you can see it is present in the pontomedullary junction. So any lesion that is present in this pontomedullary junction will affect this cochleovestibular or vestibulocochlear nucleus, that is 8th nucleus. Okay, and for example schwannomas are most commonly present here and it is seen in neurofibromatosis type 2. Okay, now 12 cranial nerve, so which will be the other lateral nerve? It will be 9, 10 and 11, and remember this 9, 10, 11 always travel together inside the skull. Okay, and they are also the all the cranial nuclei of all the three nerves is known as nucleus ambiguous. Okay, this is a very important point. Okay, and they all live together through jugular foramen. Okay, and apart from this there is another nucleus which is 7, 9 and 10, formed by 7, 9, 10. It is known as nucleus tractus solitarius. Okay, and it is responsible to for interpreting taste sensation. Okay, so it is kind of a special nuclei. Okay, so this two nuclei is important. Okay, now we'll discuss what are pure motor now, pure sensory now and mixed now. So pure sensory now cranial nerves is first of all first and second, that is smell and vision, and eighth cranial nerve. So these are all special sensations, vision, smell and hearing. Okay, these are all pure sensory. Pure motor, now we'll discuss in detail. First of all 3, 4, 6. Okay, these three nerves purely supply the eye muscles. Then 11th cranial nerve and 12th cranial nerve. Okay, I'll discuss now what muscles they are supplying. So first of all, we'll take 3, 4, 6 together because they are supplying eye muscles. So third nerve is oculomotor nerve. Oculomotor nerve means supplying the muscles of the eye. Okay. Fourth cranial nerve is trochlea nerve because it takes turn in the trochlea in the eye. Okay, so a trochlea nerve or in the orbit. Okay, sixth cranial nerve is abducens nerve. Okay, it is abducens nerve. So as you remember, there is something called SO4 LR6. This is easy way to remember about the muscles that are this cranial nerve supply. So SO4 is superior oblique, which is supplied by trochlear nerve. LR6 is lateral rectus, that is supplied by sixth cranial nerve. So every other muscle like superior rectus, inferior rectus, middle rectus, inferior oblique, these are supplied by third cranial nerve. The muscles apart from SO and LR are supplied by third cranial nerve, and it also gives its parasympathetic fiber to sphincter pupillae muscle. Okay, so it is responsible for pupillary constriction. Okay, I hope this is clear to you. SO4 LR6 is very easy to remember, and this will be important when there will be specific lesions of specific cranial nerve. Okay. Apart from this, sixth cranial nerve is the thinnest nerve. Okay, and it is the most common nerve involved in raised ICT. Whenever there is a raised intracranial tension, abducens nerve will be the first nerve to be affected by it. Okay, okay, fine. One more thing about fourth cranial nerve I want to mention here. So, for example, this 3 and 4 are coming from the midbrain. Okay, so if this is the midbrain, I'll just draw a small diagram. Okay, so for example, this is the third cranial nerve. Okay, this is third cranial nerve at the level of superior colliculus. This is superior colliculus. Okay, At the level of superior colliculus, this is third cranial nerve. Third cranial nerve, and these are your pyramidal tracks, pyramidal pathway that I'll explain in CNS tracks. Okay, so third cranial nerve will leave the nuclei, will arise from the nuclei in the midbrain at the level of superior colliculus and leave the midbrain from anterior side. Okay, but the fourth cranial nerve is different. All other cranial nerve will leave the brainstem anteriorly like this, but fourth cranial nerve at the level of inferior colliculus will leave the nerve from the posterior, from the dorsal side, and then come in the anterior, on the anterior side. So it has the largest intracranial pathway. Okay, so this is one important point about fourth cranial nerve. Okay, it is the only nerve that is coming out of the brainstem dorsally and then going anteriorly. Okay. Now, after this 3, 4, 6 is over, we'll discuss fifth cranial nerve. Okay. So, as I told you, pure sensory, pure motor. So, apart from this eight cranial nerves, all other cranial nerves are mixed nerves. So, what will be the mixed cranial nerves? Okay, so 1, 2 is gone, 3, 4 is gone. So, fifth cranial nerve is mixed now. Okay, 6 is again pure motor, 7 is mixed now, 8 now is only sensory, 9 now is mixed now, and last is 10th now. So, 5, 7, 9, 10 are mixed now. That means they have both sensory and motor fibers. Okay, now fifth cranial nerve is also known as trigeminal nerve. It has, why it is called trigeminal nerve? Because it has three divisions. Okay, it divides into three parts: ophthalmic nerve, maxillary nerve, and mandibular nerve. Okay, so it has three divisions. It also has a ganglion, if you remember, trigeminal ganglion, which is very important for trigeminal neuralgia. Okay, and it has 5 subnuclei, which is very important to understand if you want to understand the lesions of the brainstem. So again, I'll draw the schematic diagram of brainstem. This is your midbrain, this is your pons, and this is your medulla. Okay, so midbrain, pons, and medulla. So as I have told you, fifth cranial nerve arises from mainly from lateral part of the pons. Okay, so now we'll discuss the fifth cranial nerve alone. So this is the lateral part. It has two nuclei in the pons. Okay, two subnuclei in the pons. First is primary sensory nuclei of trigeminal nerve. Second is motor subnuclei of trigeminal nerve. Now it has one subnuclei which is known as mesencephalic nuclei. Mesencephalon means it is a midbrain. So it is present in the midbrain, mesencephalic nuclei, and one other is spinal nuclei. Okay, that means it is going towards the spinal cord. Now, the function of the subnuclei is important. Primary sensory, as the name suggests, it is a primary sensory, so it is responsible for touch sensation. First of all, remember trigeminal nerve is responsible for everything on the face except facial expression muscles and orbicularis oculi and this frontalis muscle. These are supplied by facial nerve. All other muscles and all the sensory supply is by trigeminal nerve. Okay, so primary sensory will be supplying touch of the face, will be interpreting touch of the face. Motor nuclei, all other muscles apart from the muscles of facial expression, orbicularis oculi, buccinator, and frontalis muscle. And this mesencephalic nucleus is responsible for proprioception of on the face. Okay, it is responsible for proprioception. Okay, and spinal nucleus means it is near the spinal cord. You can remember like this, that spinothalamic tract in the spinal cord that we'll discuss in the tracks is responsible for pain and temperature. Same thing, spinothalamic tract, spinal nuclei of fifth cranial nerve is responsible for pain and temperature of face. So this will be important, especially when we'll be discussing lateral medullary syndrome, where the spinal nuclei will be affected in the same way like 9, 10, 11 cranial nerve will be affected. Okay, so lateral medullary syndrome is a very important syndrome, Wartenberg syndrome. 9, 10, 11 cranial nerve and the spinal nuclei of this fifth cranial nerve will be affected. So the pain and temperature on the same side of the face will be affected. Okay, so 4 subnuclei: mesencephalic, primary sensory, motor, and spinal nuclei of fifth cranial nerve. Okay, I hope I am clear in this. Okay, now Okay, and so muscles, facial muscles like the muscles for mastication or chewing are supplied by this fifth cranial nerve. Okay, now we'll discuss seventh cranial nerve. So for seventh cranial nerve is very important. We'll take a different video for it because it is a very large pathway. Its anatomy is very important to understand diseases like stroke. In stroke, seventh cranial nerve is most commonly affected. Okay, and to understand Bell's palsy. So seventh cranial nerve will take separately. It is known as facial nerve. It supplies the muscles of facial expression, stapedius muscle, okay, and it gives off chorda tympani branch, okay, and it also supplies the taste sensation of the tongue. Okay, so this is seventh cranial nerve. Now ninth cranial nerve, sorry, eighth cranial nerve. Eighth cranial nerve. It is pure sensory nerve. It has two parts, vestibular and cochlear. As I have already told you, it is present in the pontomedullary junction. So it will be affected when there will be any schwannomas present in the pontomedullary or any other lesions present. Okay, vestibulum along with cerebellum is responsible for coordination and balance. Okay, so if vestibular nuclei is affected, there will be nystagmus and there can be ataxia. Cochlear nucleus is responsible for hearing. Okay, then ninth cranial nerve. It is also known as glossopharyngeal nerve. Glosso means tongue, pharyngeal means pharynx. Okay, so it supplies taste sensation to the tongue and pharyngeal muscles. Okay, tenth cranial nerve is vagus nerve. It is the largest nerve of the body and it is also known as wandering nerve. Okay, it supplies the soft palate muscles, it supplies the this laryngeal muscles, trachea, lungs, gid and heart. So all the visceral functions are controlled by the 10th cranial nerve. Okay, it is also part of autonomic nervous system, parasympathetic system. Okay, so it is the largest nerve. Again, 10th cranial nerve is a very important nerve. We'll discuss it later on in another videos. This is just a short brief video about cranial nerves. 11th cranial nerve is known as accessory nerve. It has two parts, cranial and spinal. Cranial is not very important. Spinal accessory nerve is responsible. It is a pure motor nerve. It supplies the muscles. Trapezius, important muscle. Okay, so if there is a 11th cranial nerve palsy, there will be drooping of shoulders. Okay, and sternocleidomastoid. Sternocleidomastoid, the action of the sternocleidomastoid is it moves the chin on the opposite side and it tilts the head on the same side. This is the sternocleidomastoid action, and when one side of sternocleidomastoid is lost, it is the other part will be contracting strongly and leads to torticollis. Okay, 12th cranial nerve is again a pure motor nerve supplying the tongue. It is known as hypoglossal nerve. Okay, so 9, 10, 11 now, as I told you, their nuclei is known as, along together their nuclei is known as nucleus ambiguous. They leave the skull to the jugular foramen. Hypoglossal nerve will leave the skull to the hypoglossal canal. It supplies the muscles of the tongue. Okay, so it is responsible to keep the tongue in the midline, and it is responsible for the protrusion of the lung. So whenever there is 12th cranial nerve palsy, especially if there is bilateral 12th cranial nerve palsy, then it can lead to the tongue can drop backward and can cause dyspnea. Okay, so it is an important nerve. Now remember there are two factors, two muscles actually. Okay, so the jaw muscles, the lower jaw muscles and the tongue muscles try to keep jaw and tongue in the midline. Okay, so for example, right side of tongue muscles are pushing the tongue in on the in the midline. That means towards the left. If this is the right side of the muscle, it will push the tongue and the jaw on the left side to keep it midline. Same way, left side will push the muscles on the right side to keep them midline. So these are the only two muscles. These are the only two categories of muscle which are pushing, which are actually pushing the muscles or pushing the jaw and the tongue on the opposite side. So for example, whenever there is right side of jaw muscles palsy or right side of tongue palsy, the tongue will be deviated towards the affected side, okay, towards the affected side, because the left side is contracting strongly, which is pushing the muscles on the opposite side. So these are the only two categories of muscle, jaw and tongue. Okay, that will, whenever there is one side of muscles affected, the other side is pushing muscles or pushing the tongue and the jaw on the affected side. Rest all, for example, in facial nerve palsy, if there is right side of the facial nerve palsy, left side of facial muscles will be contracting strongly. So it will pull the muscles on the normal side. So the deviation will be on the normal side, but jaw and tongue muscle deviation will be on the abnormal side. So this is the difference. Same with uvula. Uvula, if one side, if right side is affected, uvula will deviate towards left side. Okay. I hope I am clear. I hope this video helps you and your concepts are more clear. If you really like my videos, please click the like button, share and subscribe. Thank you so much.